Hello, and thank you for viewing today's webinar. I'm Megan Hudgens, one of the program coordinators with the VRC, and on behalf of everyone here at the VRC office, I hope you are all staying safe and healthy during this difficult time. So what is the goal for this webinar? If you are viewing this presentation, you likely received a couple of correspondences. The first was regarding the one-year COVID-19 extension for verified trauma centers between 2020 and 2023. And the second was detailing the process for rescheduling. This presentation is intended to help you better understand what the extension entails, including the process for rescheduling, options for your reporting year and data completion, and addressing concerns, as best we can, with maintaining compliance with standards. Now let's start with the obvious point of discussion here, site visit postponements. As of this March, the ACS has postponed all on-site visits across the various accreditation and verification programs scheduled through the remainder of 2020 by as long as 1 year. In addition, the college has granted 1-year extensions of verification to all currently verified programs, with the cycle ending between 2020 and 2023. This is to ensure that there is no gap in any verified program's verification cycle due to these postponements. We will be sending official correspondences to each trauma center containing their updated verification cycle. Now, that does mean we will be sending out emails to the current listed contacts for the TMD and TPM. With that in mind, you will want to make sure those contacts are up to date in the Trauma Quality Program's Participant Hub, so that we can ensure those emails are being sent to the right personnel. If you haven't checked your Participant Hub account in a while, or if you've had recent staff turnover, we do highly recommend that you log in and make any relevant changes. If you have any difficulties accessing your account, though, please do let us know. So just a quick example of how this would work in practice. If, let's say, a trauma center's initial expiration date would have been March 31st, 2020. With the COVID-19 extension, they would receive an additional 1 year, which would move their expiration date to March 31st, 2021. So as we go into this a little bit further, the following 2 slides will apply to verification, re-verification, and consultation site visits. So now that we've established the postponements, let's circle back to site visits and extensions, and specifically extensions for confirmed site visits between March and June 2020. These site visits will be rescheduled 1 year from the original date. The ACS will also be contacting centers individually when we are able to begin rescheduling. So let's clarify what we mean by confirmed dates. So basically this means you have received an email confirming both the dates of the visit and the assigned review team. These programs had already completed their PRQ or were in the process of doing so, and therefore you will keep the same reporting year and medical records based on the original scheduled site visit date. If you are in the midst of completing your PRQ now, you should endeavor to complete it by the original deadline, but please do note that this is a should. We completely understand that completion of the PRQ may be pushed far, far down your program's specific priority list over caring for your patients during this pandemic. We only ask that if you need an extension, you let the VRC office know. We are more than happy to accommodate you. Moving forward to 2020 site visits that did not have confirmed dates, which we refer to as pending. These similarly will be rescheduled 1 year from the original requested date. For these programs, we have 2 options available for PRQ submission and reporting year. Firstly, the default choice. You can certainly keep your original reporting period. Alternatively, you are also welcome to update your reporting period to match the new dates once scheduled. In either instance, whatever medical records you pull for review will be determined by the PRQ option that you select. If you select to change your reporting period to reflect the new site visit dates, you will need to contact the VRC office to request the PRQ to be reopened if it was marked closed. The purpose for allowing programs in this category to choose a reporting period was based on whether or not your program was or potentially will be impacted by the COVID-19 crisis. We wanted to be respectful of the time you dedicated in preparing for your visit and not have to reset the reporting period. The goal is to avoid the COVID period so that you either have solid data preceding that period or following that period. Again, we understand the latter time frame will evolve as we do not know when this pandemic will end and it may impact different centers differently. Moving on to focused visits, and specifically those with confirmed dates. Again, confirmed dates meaning email received with dates and a review team assigned. Centers that are currently verified received a 1-year verification in 2019 and were confirmed for a focused visit in 2020 will receive a one-time 1-year extension through 2021. So not centers that had a site visit in 2020 and would have needed a focused visit in 2021. So these visits will be rescheduled 1 year from the original date. That said, your corrective action plans must still be submitted 30 days prior to the original scheduled date, if not already done so. Similarly, the medical records pulled for review will remain in the same timeframe as the corrective action period. So just a few examples of how this would work in practice. If, for example, you had an initial expiration date of March 31st, 2019, you underwent your site visit and you received a deficiency, you were verified for 1 year, and would need to have a focused on-site visit by March 31st, 2020. With the COVID-19 extension, that would push you forward to March 31st, 2021. After successfully completing the focused on-site visit in 2021, you would then be verified for 2 years through March 31st, 2023. Similarly, if you weren't verified, so let's say you had that initial re-verification visit on March 31st, 2019, you exceeded the maximum allowable deficiencies and ultimately were not verified during that visit. You would have had to schedule a focused on-site visit by March 31st, 2020. So your schedule would have been extended through March 31st, 2021, since we postponed visits in 2020. And if you successfully complete that focused on-site visit in 2021, then you will be retroactively verified for those full 3 years, so taking you to March 31st, 2022, and at that point you would receive the COVID-19 extension through March 31st, 2023. So effectively 2 routes to the same destination. Moving on to unscheduled focused visits, meaning those that were not confirmed and did not have an assigned review team between July and December of 2020. This also applies to programs with confirmed dates but not assigned reviewers. These visits will be scheduled 1 year from your original requested dates. Similar to the unscheduled re-verification, verification, and consult site visits discussed earlier, you will have 2 options for the corrective action plans. You will either keep your original corrective action plan period or update the corrective action plan period to reflect the new dates. Again, medical records for review are going to reflect the corrective action period that you choose. One important note for future focused on-site visits. The previous slides were expressly addressing focused visits that would have taken place in 2020. However, focused visits that were scheduled to take place in January of 2021 and beyond will continue as originally planned. For example, just to demonstrate how this would work, let's say you had an initial site visit on February 14th, 2020. You received 1 deficiency and were verified for 1 year. And you would still need to go through a focused on-site visit by February 14th, 2021 in order to extend your verification. You go through the focused on-site visit and you pass, resulting in the standard 2-year extension, which would put you at February 14th, 2023. At that point, you would receive the COVID-19 extension, which would push your expiration date forward to February 14th, 2024. Similarly, for a center that wasn't verified, if you started with the same initial visit, you would need to have your on-site focused visit by February 14th, 2021, and then after completing your focused visit successfully, you would retroactively receive the full 3-year verification, and in addition, you would receive the COVID-19 extension through February 14th, 2024. Moving on to focused by mail reviews. Programs that are currently verified and have received a request to submit corrective documentation by mail will still need to do so based on the deadline noted in their initial verification letter. While these programs won't receive the 1-year extension on the front end, they will still receive the extension following their focused verification cycle. So if, for example, the program's original expiration would have been in 2021, that expiration date will still apply, but after successfully completing their focused by mail review, instead of the standard 2-year extension they would have received, they will receive a 3-year extension, giving them an expiration year of 2024. So a few examples of how this would work in practice. If you had your initial expiration date on March 31st, 2019, you were verified for 1 year and needed to submit documentation through a Focus by Mail with a deadline of March 31st, 2020, you would still submit that documentation by the deadline presented in your initial letter. At that point, after approval, you would receive the 2-year extension through March 31st, 2022, and then the COVID-19 extension through 2023. Similarly, if you were not verified in the initial visit, you would submit your documentation by the deadline, and if approved, you would receive verification for the full 3 years, then receive the COVID-19 extension for the 4th year. So we've spoken a lot about programs with visits scheduled in 2020. To clarify, programs verified through 2023 will receive the 1-year COVID-19 extension similar to the 2020 programs. In this instance, programs were pushed forward a year to schedule their visits. It's important to note that your reporting period and medical records will reflect your new expiration date. Moving on to your reporting year. We understand that there is frequently some confusion in this area, so we'd like to take a moment to quickly go over your options when selecting your reporting year. The options on the slide for each month are designed to provide 14 months of data prior to the site visit, with no more than 2 full calendar months between the close of the reporting period and the final submission of the PRQ, which would be 30 days prior to the scheduled site visit. The examples that we have on the slide are specifically for 2021, but for visits 2022 and beyond, you'll just want to push forward the year in each of the dates accordingly to get a sense for when your reporting period would be. Additionally, we did want to address some concerns we've heard regarding programs' ability to maintain compliance with standards during this pandemic. In the inquiries we've gotten over the past several weeks, we have definitely noticed some recurring areas of concern. Staffing has been impacted at a number of programs due to furloughs and limited remote access. Decrease in patient volume is, of course, a similar concern, both due to the general decrease in traumatic injuries while communities are in quarantine and the expanding of COVID-19 care units in some hospitals to include trauma bays. And in addition, we know that limitations on in-person meetings have made PIPS meetings very difficult to routinely hold. And of course, consultations of certain required education courses, such as ATLS, may hinder credentialing for some providers. Please know that the VRC understands the impact this pandemic has had on hospital resources and their ability to maintain compliance with verification standards. In addition, our reviewers have also been impacted by COVID-19 at their centers and will have an understanding of challenges programs may have endured during this time. Furthermore, we want to make you aware that at the VRC's discretion, provisional allowances may be issued. These will be given on a case-by-case basis and are subject to approval from the VRC chairs. If you believe that your program will encounter challenges with meeting the standards during the reporting period, please direct all specific inquiries to us through email at cotvrc@facs.org. Regarding COVID-19 extensions, let's briefly go over the matter of rescheduling for postponed site visits. So the site visit application portal is temporarily down, but please do check back frequently. One thing to note for trauma centers that have received acknowledgement of their site visit application, you do not need to resubmit your application. We will be contacting you directly when we begin rescheduling site visits. For site visits that had confirmed dates during the first 2 quarters of 2020, so January through June, you will be rescheduled for the same timeframe in 2021. Similarly, for the site visits with pending dates, July through December, your visits will be rescheduled for the same timeframe in 2021 as well. Now, let's move on to a few COVID-19 specific questions. First of all, our usual disclaimer. All questions are pulled directly from the question submissions. There have been no edits made to the contents. If your question is not answered today, the question may require more information and will receive a response from ACS staff. So first question, we received an email indicating that verification periods are being pushed out 1 year due to COVID-19. If my verification date is not until the end of 2022, will my site visit occur a year later, 2023? Yes, this is correct. So, for example, if a visit had been expected to take place at the beginning of December 2022, it would now be postponed to December 2023. As discussed, centers will receive a 1-year extension on their verification just to carry them through this period so that there isn't a gap in their verified status. And 2 questions here on reporting year. Since all ACS verifications were postponed until 2021, are we, facilities, still getting verified based on the same verification year submitted with our original applications? And then another one. Since the site visits scheduled for 2020 have been moved to 2021, what site visit year will be used for those that were canceled? Will they use the previous site visit year, or will the year be moved to 14 months prior to the visit in 2021? So programs that had a visit scheduled, confirmed with review team, so those from March to June, will keep the same reporting period based on the visit that would have taken place in 2020. For those programs that were not confirmed, so pending dates and review team, you have an option to keep the same reporting period or reset the reporting period that would then be consistent with your new site visit dates. In either case, you will pull the medical records consistent with the reporting period that you will be using. And here's another question. Can centers choose to keep their original survey date in 2021? Unfortunately, no. Since we are postponing all site visits into 2020, in order to accommodate this backlog, all visits from 2021 to 2023 will be pushed back 1 year as well. Aside from focused visits, which will be continuing as planned, centers will not have the option to keep their original survey date. And another question. We were scheduled to have an ACS Level 2 Reverification Visit December 8th and 9th, 2020. When would the new projected date be, and how does this affect the PRQ and review year? So for a reverification visit that was scheduled to take place on December 8th and 9th of this year, the review date would be rescheduled to approximately December 8th and 9th, 2021. When we are able to begin rescheduling, the VRC will be reaching out to trauma centers individually to coordinate the new review dates. And in regard to the PRQ and review year, you would select one of the following. You would either keep the original reporting period based on your 2020 original dates, or you would update your reporting period to match the new dates once scheduled. And another question. I have already applied for my April 2021 site survey. Do I need to reapply if the survey is being bumped to 2022? Can I assume that it will be moved exactly 12 months later, i.e. April 2022? So as we discussed earlier in the presentation, if a program has already submitted an application and that application has been approved, they wouldn't need to submit another application. While we can't guarantee precise dates at this time, we will be rescheduling as close to 1 year from the original site visit date as possible, and always within that general time frame. And another question, for those of us having site reviews next year, will we need to demonstrate how our trauma program handled the COVID-19 pandemic? We don't have a specific requirement regarding this, but it would certainly be advised to have documentation of your program's COVID-19 response available on site for the review team. If anything, it certainly could reflect well on the program's disaster management capabilities and PI program. And here's a question on peer review meetings. How do you handle peer review during this crisis when all meetings are discouraged and some platforms are not protected? So we certainly understand that many trauma programs have limits on in-person meetings to maintain social distancing in the workplace. While under normal circumstances, we do ask to limit the overuse of teleconferencing for participation in PI meetings, we also acknowledge that these are not normal circumstances. This is certainly an acceptable alternative if it is an option for your program. One avenue that you might want to consider is Zoom for Healthcare and GoToMeeting. These platforms have additional protections in place to allow meetings to be conducted while maintaining HIPAA compliance. That said, we do strongly recommend that any options for teleconferencing are discussed with your hospital's legal department, just to ensure that you're compliant with your state requirements for handling and discussing patient data. If teleconferencing is not an option for your facility, please do let us know via email at cotvrc@facs.org. So here's a question on research. If the site visit year is changed based on the new scheduled visit, how will this impact the research portion? So the research period will be determined by the reporting year that the trauma center has chosen, or for visits originally scheduled between 2021 and 2023, the new reporting year will automatically apply. So for programs that will be using the new reporting period instead of their original one, the research window will cover a period of 3 years consistent with the new reporting period. Basically, to summarize, it will not be a 4-year cycle. And another question, will the college go back to an every 3-year re-verification or stay with every 4, for those of us that had to reschedule our re-verification? So at this time, there are no plans to extend the verification to a 4-year cycle permanently. We will be reverting to a 3-year verification cycle immediately after the impacted center's 4-year verification cycle has passed. We've granted the 1-year verification in response to the global pandemic only, and we don't intend to keep this as an ongoing policy. And here's another question about PI. What are the expectations from the ACS for the PI process that may have to change drastically in response to COVID? What are ACS suggestions to help demonstrate changes in practice and standards for disaster response to COVID patients that are also trauma patients? So as we discussed in a previous question with regard to the PI process, the ACS does approve of the use of teleconferencing for PI meetings, just in order to ensure that the addressing of quality of care concerns doesn't come to a halt during this time. If there are additional concerns regarding the functioning of your program's PI process, however, please do let us know. To answer the second question, for other concerns regarding changes in practice and standards for disaster response during this pandemic situation, the Committee on Trauma has developed a set of guidelines to assist in maintaining trauma center access, and you can view that through the link at the bottom of the slide. And a question on the new resources manual. Will there be delays in release of new criteria for trauma center verification related to extension of verification dates and COVID activity? The VRC does not have a release date at this time, as the manual is still in the revision phase. It's worth noting, of course, that there will be a grace period upon the release of the criteria to ease the transition for centers moving forward. But we are still working towards finalizing the new requirements. More information will be provided as it becomes available. And those were all the questions we had for today. Again, if we didn't get to your question today, we will be reaching out individually to address your inquiry. But for now, thank you for viewing this webinar. On behalf of all of us here at the college, please stay safe, please stay healthy, and thank you for all you do for your patients and communities.